This is Nurses' Voices.
We're going to talk about critical care nursing with two nurses who are going to tell us a little bit about what it's like working in critical care, especially during this pandemic.
Nurses' Voices is supported by the Canadian Nurses Foundation and by the Canadian Nurses Association.
Welcome to Nurses' Voices. I'm Gail Donner.
And I'm Mary Wheeler.
Today, we're going to talk about critical care nurses and critical care nursing. And in this pandemic time that's been so difficult, and there's been so much pressure on critical care and on critical care nurses and nursing, we have two nurses to talk with tonight who are going to help us understand what it feels like. What is critical care nursing? And what do critical care nurses do to maintain the quality of their care and the quality of their life? Lisi Aldaba and Miriam Biju together have over 35 years of critical care nursing experience at the bedside. It's pretty amazing, don't you think? So I think we're going to learn a lot of interesting things about what critical care has been like, particularly now in the pandemic. Lisi is a critical care registered nurse with 22 years of nursing experience, and currently she's in the ICU at the Royal Columbia Hospital in New Westminster, BC. Miriam is also a critical care registered nurse at the bedside in Surrey Memorial Hospital in Surrey, BC. And Miriam has just under 26 years of critical care nursing experience. Maybe I'll start with you, Lisi. BC
Sure.
was doing so well during the pandemic, and things were pretty well under control. And then I think none of us are sure what happened, but all of a sudden there was quite a big surge and a lot of pressure, I think, on ICUs, and critical care nursing changed quite a bit from its pre-pandemic. So I'm wondering if you can just start by telling what that was like for you.
The first wave kind of hit, and you've got this fear of the unknown. Everything's just, you just don't know what's going on. We slide into sort of the second wave. We're comfortable. We're good. We've got everything going. You finally feel like you can take a breath, and then just the world really just came crashing. I think it just happened in the blink of an eye. All of a sudden, you're adjusting your capacities within your bed. You're moving all of these patients elsewhere. You're doing things that you would never have done, pre-COVID or anything else before. I think the hardest part being somebody at the bedside is you see all of these changes, and you know that what has to give right now is substandard care, and it sucks. It's, you're trying to just get through the 12 hours, before you're talking about stories where there was all the death and, how are we not doing this with families present and it's FaceTime? But in this, it was, you're seeing younger patients for one, which when you see anybody closer to your own age, I think you're just thrown off just that much more, because you're seeing healthy people, with families that look just like my own at home. And it's a whole new kind of fear than the fear that was there before. And I mean, at our hospital, we are the trauma center. So the sickest of the COVIDs will come to us. So all the other hospitals do their thing, but there's always going to be those few that just need something a little bit more, then they'll come to us. But you're also still getting all of the different traumas, and you were a cardiac center as well. So you get all of the cardiac people that go wrong. So you all of a sudden have an ICU that is imploding within itself. And there isn't really a word to describe it. And I can only imagine what it was like for Miriam at Surrey, or for places at Abbotsford, where long before we were in situations where we were calling it, substandard care that we, were very proud of. they were already doubling and tripling, all of their patients long before we had to. And I think it was just this eye-opening experience as to what was happening in what almost feels like this short amount of time, because now there's all of a sudden there's a little bit of breathing room again, because it was this time where everybody's compressed and you're doing all of this stuff. And I mean, God, we had multiple patients in one room, and I still can't get over that we had even done that. And again, like I say, places like Surrey and Abbey were doing that long before we had to, but we're also managing, all the ECMO patients and things that come in. And so it was exhausting, to say the least. Miriam, what was it like for you guys?
I just had gone back to work after a year in 2020, and like mid-March, I had to ask others about how the first few patients were, because I wasn't there. And all I heard was, oh, the first patient was someone who was just anxious about their situation, their diagnosis. So that sounded okay. So this is the first patient, and then it progressed from, I guess we just had one or two patients who were just simple. From then on, we moved on to seeing patients on high flow oxygen. Prior to COVID, we didn't consider these patients to be as droplet when they are on OptiFlow or CPAP. But then with the COVID, we started having to put the PPE on with the 3M mask or the N95. What are the procedures that are AGP or the aerosol generating, and what are not, was always changing, evolving. I have to say the first wave, most patients were intubated fairly early. And then it felt like they needed prolonged ventilation. So when the second wave came, they tried to not intubate them. So with the second wave gave us an opportunity to see a lot of people talking, telling us stories, telling how they got the COVID. I can't believe if there wasn't FaceTime, how people could have at least a few precious moments or things that they could remember for their lifetime. And I remember this letter from this patient family, how it appreciated that you were there when we couldn't be there. And those emotional letters meant a lot. I remember FaceTiming when family, for the teenage kids, the mom just managed to say I, and the L wasn't clear enough. And then you could figure out she's trying to say I love you. And those were all very emotional moments. But on the other side, you are doing your job where you have to concentrate on numbers and waveforms, and you have to force people to stop talking and put on their face masks. Sometimes on a shift, you could have one admission and you could have another admission. But to have once someone goes out at 2 o'clock, another one is already ready to come in. I just admire the way nurses went above and beyond. The craziest thing for me was these are not people who have been sick at home for a few days. Some of them are coming from a COVID testing center to the hospital. I mean, some patients seem like they were coping really well. They were able to talk, they were able to eat, but you could see that their oxygen levels were going down. That was the weird thing about COVID. They could even talk sentences, but their oxygen numbers were going down to the 50s and 60s. And then came nurses thinking, are we doing the right thing? Patients are not being intubated for such a long time. I mean, it is not a nurse's call, but still watching patients suffering to breathe, nurses started thinking, oh, is this the right thing? We leave them on the OptiFlow and on non-invasive ventilation for such a long time. By the time their intrinsic abilities have gone down, they are getting a little bit more sicker. They are not, will they make it if they go on the ventilator? And unfortunately, there came a time when we saw a lot of patients who went on the ventilator after prolonged non-invasive ventilation that did not make it. Who knows what was the best? And third wave was shocking. From 26 capacity to going up to 58 or 60 patients.
So maybe this is a good time, though, you've expressed, both of you, really how much stress on families, on the patients, and on the nurses themselves. How then, with all this stress, both moral stress and even physical stress, I'm sure, mental stress, how do you get up every day or get up at night or whatever and go in again and give so much of what it's clear both of you give to every patient?
I have always prided myself in being able to find a career that I loved. This whole third wave, it is a challenge just to get up knowing that you're going to go to work, to get in the shower, get in the car, and then you park underground and you're like, God, what is it going to look like up there today? And you know it's going to be some sort of a disaster. And I know that I echo a lot of my colleagues. I think that's what makes us human, is that it's been morally distressing, it's stressful, it's exhausting, it's physically draining, it's all of those adjectives really all sort of rolled into one. I think for myself, the nice thing is I have a supportive family that understands, one, what mom does for a living, that I work in COVID hell every day. So this is what I see. So they're sensitive to that and they're very supportive. So they know that, a closed door when mom's sleeping post nights, you don't go in there. So that's kind of a nice thing. But I think with me and my colleagues, I think the only thing that's getting us through this wave is us. We've gotten really good at being able to read each other's eyes, and you're just able to know where everybody is. And it's just been that mental strain of, I think that's the question, is how do you keep going? We, like Miriam, have been in situations where, you've sent, a patient has just passed, and as you've taken the room down, you're already getting notice that you're about to admit another patient. So pre-COVID times, it was a nice thing. You would have somebody pass nice and peacefully. You'd have family there. You'd be able to support them. You'd be able to hug them. You can all cry together or give them what they needed, and then sent them on their way with a nice grief package. Now it's, have I shut the FaceTime off when I take this room down really quick? And then you don't get the time to have a break in between to recollect yourself, because you have another patient that's going to come up. And as I touched upon, we're the higher center to go to sort of in the region. So in this last wave, I hope it's the last wave that we've seen, it's been the sicker patients, the patients who are going to need the ECMO, who need, CRRT. So we have a lot of COVID baby nurses that have come out who aren't full scope yet. And so a lot of the weight falls on those that are full scope, because now you've got to you've just done this, now you have to take on another patient. So it's, it's exhausting, but I think the only way we've been able to sort of get through this is really through each other, right? I mean, as nurses in critical care, we're the only ones who really know what we're going through, because we're all going through it together.
But so Miriam, what about for you?
So I think what kept us going was everybody who had to put in their best. I think everybody just, nursing is our profession, our job. We have all in one way or the other committed to doing it. But I think there was that sense of, yes, I have to do my best. I got to help in the situation. I'm in this profession where I can play a role. I feel like the world saw it. It was so encouraging to look outside our window, writing saying, this is where the heroes work. Thank you, SMH ICU. And every person, including the person who is cleaning, who is stocking up, who is giving us food trays, the people who are calling the families letters, all this helped. I have to say, my children helped, my family helped, my husband helped, everybody helped, because everybody talked about how stressful it was, but everybody kept going. I don't know where all that energy came from. I think we all as human beings have it in us to just use it when we need it. We just come up to the need.
You two are amazing, I have to say. I'm sure there will be young nurses who are thinking, oh, I didn't know it would be so difficult. I thought I'd like to be a critical care nurse, but maybe now I'm thinking twice about it. What would you say to those nurses who are thinking about a career?
I came from Emerge. I spent 6 years in Emerge before I came up to critical care. And a big part of it in that move is within myself. I know I'm a bit of an adrenaline junkie. I just love it. If something big is happening, if there's a trauma that comes in, I'm in there like a dirty shirt. That's my bag. I think that even through all of this that's going on, I know as soon as we're sort of able to just kind of shake that dust off as to, what we're sort of feeling right now, at the end of the day, I think every critical care nurse will just kind of say, this is still what we want to do. I think that being a critical care nurse, it takes a special type of person. It takes a nurse that is marginally OCD, but just with the ability to want to put it all together. There's a reason why we only have one patient, because we can look at each and every detail that goes on with that person and give the absolute best care. And although now, with the way the world is, at times we feel we're giving substandard care, things aren't really the way that they are. I hope that our COVID nurse babies that have come, we'll be able to whip them into shape at the end of all of this and be like, okay, that's actually not how it's done. This is how we're going to do it. This is what's the best care. We just did that to get by. Critical care is, if you're going to have other nurses listening to this, I might make myself in trouble, but critical care is the best. Truth be told. When I left Emerge, my goal was to find the complement to emergency nursing that I knew that critical care was going to be. My goal was to stay the year that I had signed my contract for and come back to Emerge. 16 years later, I'm still here. So that in and of itself has got to say something, right? It's a place where we can be proud to be able to give the technical care that comes with knowing all the different, vital signs and blood work and all that sort of business, but you're also able to give that personal aspect. We shave all of our patients, right? When someone's going to be going end of life then tomorrow, we will wash their hair with like actual shampoo. It's a full soap and body wash. You do all of those little things because you can. And I hope to get back there soon.
But I can see that getting back to why am I doing this is in itself a kind of help to traverse the bad times, if you will.
I think in your story so far, from both your stories, you are nurses who I want to have at the bedside if I was in need of critical care nursing. But I think it's important. What do you want to, here's a great platform. What do you want to tell nurses, Miriam, about what keeps you doing critical care and what they should think about if considering this as a career?
You are in nursing because it's your choice. You have made a choice to care for people. And if you want to care for them when they are sick as they can be, then this is your place. I have to say, critical care nurse sometimes makes me feel like they are born for this. There's something in their genes that make them do what they are doing. You will be in a career where every small assessment you make, you feel like you are the one that is talking for that patient. If the patient is going to a GP and saying like, my abdomen hurts, this is where my pain is, this is where my swelling is, this is where I feel numb, or this is the part of my body that if they are moving and they feel a chest pain, they can say it. But when they are not able to say it, the nurse is the one. Yes, I found the ST elevation. I see that their heart rate is up when they do this. I see that their heart rate is going down when their oxygenation is not adequate. They are more sensitive to this drug. They are not so sensitive to this drug. So it is, I am the patient sometimes because I see it. I am the family member sometimes.
But I do love what you said. You said, I see you.
As critical care nurse, you are given the privilege. It's a privilege to be a nurse for one patient. It is a privilege to help someone who is helpless. Nurses can do wonders. Nurses do wonders.
Well, all I can say is I wish we had lots more time because there's lots that we could talk about. And you clearly both have had such a rich experience. I'll just add and close by saying the very biggest thank you. I'm so grateful for myself in having had this opportunity. It's both of your genuine humanity for your colleagues, the public who've tried in their ways the 7 o'clock banging of the pots and pans, the food. And you didn't talk about it, but clearly your families were very important to you in all of this, as well as your colleagues. So I thank you for being so open.
Gail, I have to say that was an awesome interview. And when I think about what Nurses Voices is all about, it's really providing a platform for nurses to tell it what it's like in this moment in time. They represented nursing in its totality, but two different sides of the coin. So Lisi, when she talked about, and maybe it's the setting she's in, she said, from emerge into this trauma center or the setting that she's currently working in, really distressed sometimes that she wasn't able to provide the ultimate level of care that she generally would provide if she had one patient. So that's what I heard from her around the skill and the knowledge. And sometimes it was being compromised, but there was really nothing that they were trying to do their very best. Miriam brought another side of what nursing is about, and really that human side. So she really spoke about that connection with the patient. And I love when she talked about, that acronym, not intensive care unit, but ICU, that I'm really, especially with COVID, I'm your voice to other healthcare practitioners around. So what I loved about that is that it was really two stories, but if you put them together, it's like one half and the other half. It is that total picture of what nursing is, no matter whether you're in the intensive care unit, working with the homeless and other speakers. So it was really interesting to see what they brought to this conversation.
I think I feel the same way you do. The only thing I'd probably add is they both in a very different way had such amazing passion for the work that they do.
Yeah.
And I guess all I kept thinking was how they are so real. And I was hoping that nurses who are watching, who maybe are feeling a bit dispirited, these are very difficult times. And the press is full of, nurses are leaving in droves, and, so many nurses want to leave. After COVID, we're going to have problems, etc. And I just hope those nurses who are feeling maybe that they aren't being heard will listen to these nurses who, what they've experienced has been terrible, but they haven't lost the drive to carry on. So that was one thing. The other thing that I have to say is I thought, we're calling this nurses' stories. They were telling their story, but I kept thinking that, how they described how they are with their patients, they're actually trying to understand the patient's story so they can give the best care they can in whatever the circumstances are. So, but I agree with you that it was a special reflection of what nursing is.
But that's a nice connection back to our very first episode, where the two Chantels talked about storytelling and how we really, we need to be not only telling our stories as nurses, but using that strategy, that intervention with our patients to tell their story, or to help them tell their story. They really were the spokeswomen for their patients.
Yeah.
The other two things that, especially with our work and careers, and I think Lisi brought it up, is that you have to love what you do. And I think no matter who we have on Nurses Voices, we're having public health nurses, we're having nurses working in long-term care. What is evident and what we're hearing, and maybe it's just in the guests that we've chosen, but we've tried to be really intentional, is that these individuals love what they're doing. That's what comes across for me, is that, and that's what we say to people when we help them try and figure out their career. If you're not happy, that's okay, but then to find a different place. But for these women, they have found a career that they love, and that even in the hard times, what they also say, and what's a theme that is coming out in these nurses' voices, is that there are these teams. It's the people that you surround yourself with. We know that from the work that we do, but also for them, who they surround themselves is a make or break. It's that, it's the, something we've used in the past, the crabs and the dolphins. Surround yourself with dolphins and move away from the crabs. And that's what, it's maybe making light of it, but I'm hearing that in all of these nurses' voices stories, the people that I surround myself with, I'm passionate about what I'm doing because I'm working with a team of people that are passionate also.
And when I mean, it's a while since I've looked, but when I looked at the literature all about what nurses want, that's one of the things that nurses have traditionally said contributes to them being able to do their best work.
Right.
Is being surrounded by others who want to do what they're doing and do it well, etc.
Yeah.
So yeah.
So this was great, and it was great, and I'm looking forward to the next Nurses Voices.
Me too. Thanks for joining us for this episode of Nurses Voices. We hope you'll join us for the next episode. And until then, please go to nursesvoices.ca and give us some feedback and perhaps tell your story. We've already heard from several nurses who've both provided us with some good feedback and also told us a little bit about their practice and their nurses' stories. So please do that. Also, Nurses Voices is available also on YouTube. It's available as a podcast. So please use whatever platform you usually use and follow us on Nurses Voices.
Nurses Voices is created by Donner Wheeler. It is supported by the Canadian Nurses Foundation and the Canadian Nurses Association. Nurses Voices is produced by Sector Limited.